Everyone. Welcome to our third annual Black Nurses, Past, Present, and Future, Building Our Healthcare Legacy program. Before the pandemic, we usually had this in live, but we're doing this virtually this time, and we welcome you to our show. I'm going to tell you a little bit about Yes to College Education Resources, Inc. We're the sponsors of this recording, and along with the Capital City Black Nurses Association, the Brick House Gallery and Art Complex. I have to read all this. There's so much going on. The California Endowment and African American Women's Health Legacy Program. Yes to College Education Resources, Inc. is the sponsor of this event. And our program, one of our main programs, the African American Women's Health Legacy Program, supports African American women in their quest to obtain resources for diabetes, hypertension, and obesity in the Sacramento, California community. We also have a program called the Minority Health Professions Mentor Program, where we help to prime that pipeline for healthcare professionals with our African American students in the middle and high school and in our community. So today we are sponsoring the Black Nurses Present Oral Histories Surviving Pandemic Emergencies. And we're interviewing past, present, and future healthcare professionals who are nurses. So without further ado, I want to introduce our guest speaker today as who is presently a healthcare professional, a nurse in Sacramento, Dr. Ricky Norwood. Welcome, Dr. Ricky. We call him Dr. Ricky because he works with our students in our mentor program, and he also helps us with our African American Women's Health Legacy program. So welcome today.
Thank you very much. I'm very happy to be here. Thank you.
First of all, I know people are saying, okay, well, we have a male nurse. That's kind of unusual. But from your experience and from me knowing you personally, you've been a male nurse for a long, long time.
26 years and
26
counting.
years. So this is nothing new or a trendy or anything else for you. This has been your life experience. And so we want to know, why did you become a nurse? Of all the things you could have been, all the opportunities that are out there, why nurse? Why a nurse?
Sure. And before I started, thank you very much to Yes to College for inviting me to share my experiences as a nurse, as an African American male nurse. And it is just a sincere delight to be with you all. And hopefully I can say something today that will inspire someone to come into the nursing profession. So thank you very much.
You're welcome.
So why did I become a nurse? Well, I didn't start off to become a nurse. Nursing was, I would say, far, far, far away from my mind. When I graduated from high school, I wanted to leave the great state of Mississippi because there were no opportunities there. I mean, although I had gotten 3 scholarships to attend 3 of the historical Black colleges in Mississippi. Had I gone, I didn't have any money, and my parents didn't have any money, so I would have been down in Mississippi at one of those colleges, just there going to school, but worrying every day because I didn't have anything to support myself or any money to support myself. So I joined the military as an enlisted man. And I think that was the beginning of me recognizing that a change needed to happen in my life. I knew a change needed to be happening in my life initially because I wanted to come out of the cotton fields of Mississippi, the bean fields of Mississippi, the rice fields of Mississippi. And I prayed to God, there has to be something better than this. And he answered my prayer, and he sent the military my way, which was a godsend. And when I got in the military, right out of high school, I thought I was important because in high school, I was the senior class president and, won the highest award of my high school that you can win. It's called the Citizenship Award. And so I was a leader in high school. And when I joined the Army as a private E1. That is at the very bottom of the ranking scale, of the ranks. And I didn't know that at the time. All thing I knew was I was going into the military. And then it was a real eye-opening for me, because when people, or the sergeants and the drill sergeants, would say they wanted someone to be in a leadership position, I just knew they were going to call me, but they didn't. And the reason they didn't call me is because I was an E1, a private E1. And in the military, it is all about rank. So the private E2 or the PFC, the E3, or the specialist E4 would always get those leadership positions. And I'm like, wait a minute. What about me? What about me? I was my high school class president. I was, I was big in high school, but it didn't matter. Hill of beans in the Army. And so I knew I had to make a change. And then another eye-opening thing was that rank matters, but I was also going up against it was essentially racism. I mean, I'm coming out of Mound Bayou, Mississippi, a historical Black town. So it was all Blacks where I was. So the only interaction I had with whites were with my father's boss. He was a white man. And so that's the only interaction I had with a white person. And so coming out of Mississippi, out of high school into the military, this is my first experience with multiple cultures. And it was an eye-opening experience for me. And then it was even a more eye-opening experience is that I'm a Black male, I'm an E1 private, and no one is recognizing me. And what can I do about this? And so I had a sergeant who told me, Rick Norwood, he said, private, the only way you're going to get anywhere is that you get some education behind you. And I'm like, okay, but here was the problem. I am starting out of the great state of Mississippi. The Mississippi public school system was not the greatest. And now you want me to go and get education. So I was afraid to go to school, to go to college. So I delayed that several years before I went to college because I was simply afraid. And then I got married, and my wife decided that she was going to get out of the military, and I was comfortable in the military because I was just comfortable. But so she essentially forced me, get out. It's time for us to get out. And I'm like, no. So she drugged me out of the military, and we came out to California, to the Sacramento area. But we essentially ended up in the Sunnyvale area. And I was decided that I was going to go and get a job. And so I found myself back in the military because that was easy for me. That's what I knew. It was the active guard reserve. So I was a reservist on active duty. And my wife went to school, and she got her degree from San Jose State University. And then the military offered her an active duty commission. And I said, okay, we're getting somewhere now, because now that she's an officer, I'm still enlisted. And so I always wanted to be that officer because officers were the leaders. And I'm like, how can I get there? How can I get there? And she said, you probably need to go to school to get that. And I'm like, well, I don't know how I'm going to do that. And I decided to get out of the Army, and I became a police officer in San Jose. But because I had to leave that job because, they sent my wife over to El Paso, Texas. And then I went to El Paso, and I had just finished the police academy, went down to the police department and said, hey, I'm here. I just came out of the academy. And they said, sorry, we're not hiring. Go to the Border Patrol. They told us, sorry, we're not hiring. And I came back, and I was just frustrated. I'm like, these people, they're not hiring it at all. And she said, well, Rick, why don't you become a nurse? And I looked at her and I'm like, a nurse? Are you kidding me? And this was the mindset of me at the time. Nurses are for women. And I said that and not to offend anyone or not to be rude or anything, but that was the first thing I know. Nurses for women, because in my experience, the only nurses I saw were women.
Yeah.
And I said, nurses are for women. And she said, Rick, if you become a nurse, the Army would give you a direct commission. And I'm like, what? You mean they're giving me a direct commission? That means I can become an officer? And she said, yes. And I said, sign me up.
Wow.
And that's how I became a nurse. And I was home one day from the Army. I had joined the Army as a nurse. I finished school. I finished nursing school, University of Texas at El Paso nursing school, and I went home and I told I was visiting my grandmother, and she said, "Rick, how you doing?" I said, "I'm doing fine, Grandma." And she said, "What are you doing?" I said, "Oh, I've decided to become a nurse." And she said, "And you'll be a good one."
Oh, wow.
And when my grandmother told me that, that was a true validation for me that if my grandmother says that I'm going to be a good one, well, you don't let grandmama down. And so that was my running orders to be a very good nurse. And I took that from that day on to become a very good nurse. And I had to do everything that I could to be that nurse. So that's how I became a nurse.
Wow. Well, you said you've been a nurse for 26 years. What have been your most, I guess, memorable experiences in nursing and letting you know that you made the right choice?
Sure. My most memorable as a nurse, and it's happening. It was then and it is now.
Mhm.
Making a difference in patients' lives, making a difference in patients' lives, a positive difference.
Mm.
I am the one who can talk to patients and say, this is what's going on. This is what we need to do. If you follow these instructions, or if you follow these guidelines and parameters that we're giving to you, your life will be much better. And the true validation came when the patients come back to me, not just as a bedside nurse, or not. I was an operating room nurse for 7 years, but and more specifically as a family nurse practitioner. That's what I'm a family nurse practitioner now. Patients come back and say, "Thank you. Thank you, thank you, thank you, because you saved my life. You made a difference. What you told me, and I took your advice. And now, at one point I was deciding to do something else, but because you showed me the thing that I needed to do, I'm much better off. Thank you." And so those thank yous make me want to do even more to help patients in their daily lives, and with their health, with anything that I can give, any kind of encouragement. Nurses are advocates of our patients. So it's not just healthcare. It is we're giving guidance and counseling on all aspects of life of a patient. When they're in with us and they're talking to us.
But in saying that, do you think that nurses get the proper or enough training? And I mean, your nursing is holistic. You're not just treating the surgery or the illness or
Right.
the disease, but you're saying that nursing is holistic. So are nurses properly trained, or are they receiving enough training for that?
Nurses are very well trained. Yes, they get the proper training. A lot of people, if you ask a person in nursing, "Why did you go into nursing?" or why are you a nurse?" and they'll say, "Because I like to care for people."
Mhm.
But you'll be amazed that nursing schools, and especially medical schools, they don't have a curriculum for caring.
Right.
Okay. And so there's a big deficit. We say we're going into this profession to care, but what is there to teach us how to care? We're coming with our own personal experiences, but what is there to teach us how to care? What is the significance of caring, or what are the aspects of caring? And so I had the opportunity to come up with a project that I was working with the UC Davis, and I have designed a class that I teach. It's called Caring One-on-One 101. Caring One-on-One 101. This is what caring is all about. So when you say you're caring, are you using these aspects of caring with your patients? And so there are different layers of caring. You start off as a novice, and you get the knowledge, and you get this and the skills of caring, and then you can apply it. And truth be told, it takes a while to become a caring nurse. Okay, I can say kind words, yes, but it's just not kind words. It's your actions as well. So nursing caring is about a whole lot of things. And so that's why, nurses are different, in my opinion, from doctors. Doctors go on a medical model. In other words, it's a disease model, whereas nurses are coming in and we're treating from the heart. Okay, we don't. Nurses aren't embedded specifically or totally in the disease process, but caring for folk, about caring for, again, that holistic or all of the patient, not just this one medical aspect of the patient.
And that has to be particularly important now in this pandemic. I know in 26 years you've seen several or many pandemics, emergencies, but it seems like, this is the one we're living through now.
Yeah, right.
And we were totally unprepared, and it's been, devastating to our everything, to our economy, to our lives, our family structure, our education, everything. So what advice or what have you noticed or gleaned from nursing during a pandemic emergency? How is that different, or is it different?
To me, it is really not different, because we have our job to do, and our job is the same no matter which disease process we're fighting. As a nurse practitioner, or even as a nurse in the operating room, or a nurse on a medical surgical floor, or a nurse in a clinic, our jobs are to take care of patients. And that model or that template of taking care of patients is the same across the board. Okay. Mm-hmm. Now there are certain levels that we have to really take into consideration, especially during a pandemic such as the the COVID-19 pandemic. All right, but we've gone through Ebola, we've gone to the bird flu, we've had the bird flu, the swine flu, we've had all of these diseases that have broken out, of these viruses that have broken out, but we were handling it. If we look back over it, okay, we've done, as nurses, what we were trained to do, what we were educated to do, and that is to take care of patients. So is there a difference? The big difference now is that we're in this pandemic that the whole world is affected by it. Okay. And so now we're running into things that resources that are available, or resources that are, or to be bluntly, resources that are not available.
Yeah.
We're running into, because especially people of color don't trust the medical system, because we've all heard of the syphilis the syphilis project, the Tuskegee syphilis study that they had, and they kept this information from Blacks, right? They had a cure, but they're using us as guinea pigs. So when you start saying that, we have a vaccine for the COVID-19, and most people go, oh no, I'm not taking that. They're just using us, and they have come up with all kinds of excuses, and I've gotten hit with all of these excuses, not just from patients. Brace yourself, even from providers. Okay, yeah. I mean, I have colleagues that said, I'm not taking that. Oh no, I'm not taking that. I don't trust it. I'm going to wait for a couple of million folks to get this and see what the reaction is, because I don't trust it. And that's what we're running into. We're running into that trust factor. Do we trust the medical field to do the right thing? And that's hard. And when you're running up against trying to tell folk that, you know what, we have two vaccines out there. We have the Pfizer, we have the Moderna, and AstraZeneca is coming on board. And they're like, I don't care what we got, but these things are effective. The Pfizer is 95% effective. The Moderna is 92% effective. Those are high effective rates. But I don't know. They're saying this because of this, and they're saying this because of that. People still do not trust it. And so it makes my job as a nurse practitioner even harder to go in and convince folk, hey, listen, we got to get this vaccination. You go and, people of color, and especially, I go to church and people are praying, oh Lord, please send us an answer to this vaccine. And we need this. Well, God has sent you some vaccinations. Okay. Yeah. Take them. He's answered our prayer. So let's take these things and be trusting in the system to say that they're doing the right things and this is the right thing to do, because the first thing you want to do is you want to have that family reunion because, oh, I miss, Ray and JJ, and I miss Aunt Lucy and Uncle Bob. Well, get your vaccine. Okay. Therefore, once we all get vaccinated, then we can come back and start having all of these, family reunions and class reunions and high school graduations and all the things that we're missing out on, going to sporting events and dancing and going to wherever you like to do. Right. So we as nurses, we as nurse practitioners, we as whatever the role we have in nursing, we have to be we are on the front lines to educate folk to say, this is safe. Forget about all of these, conspiracy theories, all of these miseducation of this pandemic. Let's do the right thing because we've been doing the right thing for ever.
Right. So with that said, and we're talking about, we like to talk about or like to work on the disparities, not only the health disparities, but also the disparities in career choices that African Americans are affected by. So during a pandemic like this, does the African American community look to African American health professionals for the truth, to follow, for the leadership? Is that important that we have African American health professionals, for us to look to, or does it make a difference?
No, it is absolutely imperative that we as African American providers, I say providers because I'm a nurse practitioner, or African American nurses or healthcare professionals, are standing on the front lines and showing our people this is what we're supposed to be doing. Okay, but here's the problem, Sharon. There aren't a lot of us out there.
Exactly.
There aren't a lot of us out there. I was thinking just today, in my education, in my nursing education, how many of my instructors, nursing instructors, looked like me? In other words, how many were Black?
Mm-hmm.
Dos, two.
Yeah.
Two. And I didn't see
education, all of your nursing education.
Right, all of my nursing education. I had one in my bachelor's for nursing in El Paso. Okay, Dr. Gardner. Okay, that's one. Mm-hmm. And the other one came in my nurse practitioner's program, and that was Dr. Sandra Bibb. Okay, mm-hmm. Two. And how many males? Zero. No. Zero male instructors. Zero male professors. Mm-hmm. Zero. In my doctorate, no Blacks, none. Right. So when I went over into the School of Nursing, where I work now, the Betty Irene Moore School of Nursing, how many Blacks were there in the School of Nursing? One. Yeah. One. And he's now gone. So I am now the only Black male in the School of Nursing. On faculty. Faculty. Not staff, on faculty. And now if I look around and if I really think about on staff, I could probably count them on okay, these four fingers and thumb. Okay. We are essentially still 1 to 2%. Okay. In the probably the UC Davis system. Okay. But nationally, I don't think we're over 12% nationally. No. So where are the Black folk? Okay, it's amazing and it's wonderful that I work at the Sacramento County Health Center. When Black people come into the Sacramento County Health Center and they see me, the first thing is, oh, he's a doctor. I want him to be my doctor, right? They don't know me from John, right? And they don't know, what kind of provider I am, but they see themselves in me.
Right.
And so I want that doctor to be my doctor. Okay. And so they gravitate towards you because they trust you. Okay. Right. They trust you. And so I have to do everything I can. I have to get the education that I need to make sure that people are coming to trust me. Okay. So I want to make sure that I know what I'm talking about. Right. Yeah. Because our people, as soon as you tell somebody something that's not right, oh no, he didn't know what he was talking about.
Exactly.
I thought he knew what he was talking about, and I don't want that to happen, right? So I try to get all the education I can. I try to read as much as I can to be able to inform folk, okay, of the things that they need to know to make themselves better.
So personally, if you care to share, are you going to get the vaccine?
I've already got it.
Oh, you've
I've,
already
already- I've gotten my second shot, and I feel fine. And I tell everybody, whoever's listening, please share this link, send it out. It is safe. Okay, I feel great. Okay, the first vaccine, it was nothing. It's just like if you ever gotten a flu shot or any vaccine, your arm is a little sore. Okay, the second one that I got a little tired. Okay, a little tired. I mean, I didn't and so, but that got over. You know, in about 24 hours, I was back feeling fine. I'm feeling fine. I got a little tired. I didn't go to work the next day because I knew it. You know, I didn't want to get there, and it is still within 24 hours of getting it. So a lot of my colleagues have gotten, and they said, well, that second dose is far worse than the first one. So I started feeling, well, okay, I feel a little tired. I don't want to risk it. So I took off the next day. But after that Monday came around and I was feeling fine. And I tell anybody, look, get the vaccine, get it. Okay. We've asked for it. We got it, you know? So get it.
So we talked about nursing. We're talking about nursing. So what are the opportunities? You know, you've spoken about your need or your want, your desire to be a leader in the health field. Now, what are the true opportunities for African Americans, and what are the realistic possibilities of getting to that leadership role?
Sure. Yeah. Opportunities are abound. Okay. Opportunities are abound in nursing. Okay. If the mind can conceive it, you can achieve it. I've heard that. And it's true. Okay. If you want to go into nursing, go into nursing. Okay. It's just like going to any other profession. All right. And what I hear from young folk is that, oh, it's going to take time. Well, what else do you have? You know, if you don't have time, you're dead. Right.
Exactly.
And don't tell me that it's hard. No, I mean, well, okay, it's hard. Okay, but what is easy? Okay, you don't want to be going through life easy. All right, do the hard thing, because when you go through that hard thing, right, and you achieve it, you feel very, very accomplished. You feel successful, right? And you're going to go out, and then you know, when people say, well, if I can do it, anybody can do it. Well, I can truly stand up and tell you that, you know what, I'm standing on the shoulders of giants. Okay, they've done it, and they had a whole harder time than I did. Okay, but they paved the way for me. So I'm standing on their shoulders, and you know what I'm doing? I'm reaching down and I'm saying, come on, brother, come on, sister, you can do this, because I did it, because I'm standing on the shoulders of the folk who said that I could do it. Right.
So what are some of the different nursing positions that you can strive for, go for?
Sure, anything that you think of. If you want to go into education, I'm in education. But if you want to go into the clinical realm, I'm in the clinical realm. So my job is unique at the Betty R. Moore School of Nursing. I'm a clinical educator. In other words, I'm 80% in the clinic seeing patients and 20% in the classroom teaching. Okay. You can go into administration. Okay, nursing administration. If you like to, I don't want to be seeing patients every day. I just want to sit in front of the computer and do this. You can go do that. Okay, you can go into nursing research. Well, you know, I want to go and research this and research that and see what it is, and you'll be amazed that if you look at any study, guess who's the lowest? Guess who is the lowest folk who are volunteering to be in a study? African Americans. Because we don't trust it, right? Yeah. But if they see someone like me who's into research, they'll say, "Hey, I can go there because I trust him. Okay, he looks like me, so I'll trust him more." Okay, so that's research. You can go into you can work in a clinic. Okay, you can cardio, whatever field you want to go into, whether it's being urology, cardiology, women's health, emergency room, operating room, ICU, any of that, any any aspect of nursing is available to you. Okay, you just go and get your basics. Okay, you go get your basics and you get your degree, and you can sprout out into any one of those that you want. It's yours for the taking. Yours for the taking.
Well, since I've known you, I was surprised. I was surprised that nurses can be doctors.
Yeah, they can be doctors. Well, they call me
doctor
they,
nurse.
yeah, they call me doctor because I have what we call the doctorate of nursing practice. It's a DNP. Okay, but there are nurses with doctors of nursing science. Okay, they call them doctor. You have the PhD doctors. Okay, and so yeah, you can get a doctorate in nursing, and that's what I did. I got a doctorate in nursing. So a lot of the medical doctors would say, "Well, you're not a doctor," and I'm like, "What does that mean? I'm not a doctor." My doctoral degree is equivalent to your medical doctor's degree because we're all at the same level at that doctoral level, right? So I'm not going to sit around and tell you that, well, when I go into clinical practice, I'm not going to have my patients call me doctor. Oh, yes, I am. Okay, I've earned it, right?
Yeah.
And you call me doctor. So I'm not saying that I'm a medical doctor because every time I introduce myself to patients, I say, "Hi, I'm Dr. Norwood. I am a nurse practitioner." Okay. And there's that distinction. I am a nurse practitioner, but I'm a doctor because I have a doctorate in nursing practice, right? And so, and it's amazing how we're still fighting this battle that, when we as nurses get our doctorate and they're like, "Well, I don't want nobody calling me doctor." And I'm like, I don't think so. Yeah. Why? Why not? You've earned that.
Exactly.
You've earned that.
Yeah. So, when we talk about some of the challenges, what were some of your challenges in becoming a nurse? The financial or, like the studies or whatever.
Okay, I'm going to tell you. I'll tell you two stories. Financially, I didn't have a challenge because I was in the military.
Oh.
Okay? And the military pays for your education. All right.
Right.
So when I was, when I got my bachelor's degree. To get a master's degree, that's the military paid for that, for me to go to nurse practitioner school because that was my job. Nurse practitioner school was my job. Okay. Mm-hmm. And when I retired from the Army, I was able to get the Montgomery GI Bill, which gave me 36 months of free education. Ooh. Okay. And on top of that, they gave me a housing allowance or a living stipend, right? Mm-hmm. And that living stipend was based on a military rank, an E5 or a sergeant's pay in whatever city that they were living in for whatever housing that they were offering at the time. Mm-hmm. And it's based on, and so my school, I chose the University of San Francisco. Okay. The University of San Francisco's housing stipend for a sergeant was $3,000 a month.
Oh.
So I took advantage of that. Right. So that's $3,000 that they're giving you on top of paying for everything. Okay. And then I had enough money left over. I went and got a master's degree in behavioral health, all free, paid for by courtesy of the Montgomery GI Bill. So I didn't have that. And so whoever is watching, if you want a way to pay for your education, I'm not telling you to go in the military. All I'm saying is that's the route I took. Ask me how many student loans I have. It's zero because I got 3 masters and a doctorate from that. Now, what are the things that are in my way? What obstacles did I go through? Okay. It would surprise you to tell you that there's racism in the military. Oh. And it hit me smack dab in the face, live and in color. All right. At one duty station, I was loved by my bosses. Okay. They sent me to the emergency. They sent me to the operating room. They did everything that I wanted, everything I asked for. No problem, Lieutenant Norwood. We got you. Go ahead on and do it. I'm like, all right, this military thing is all right. But when I got to San Antonio, different story. Mm-hmm. The chief nurse there, she didn't like Ricky Norwood. Okay. So I was an operating room nurse. I was a very good operating room nurse. And I said, you know what? I want a little bit more autonomy. I want to take advantage of this nurse practitioners program that the Army is offering. And I went to her and I said, hey, and you had to go to her and say, I want to apply for this nurse practitioners program. And she said, you know what, Rick Norwood, that's a very competitive program. And, I don't think you're ready for that. And I'm like, what? What you mean you don't think I'm ready for this? Like, okay. this is what I'll do. I'll go down and I enrolled in the University of the Incarnate Word in San Antonio, 2 classes, 2 master's degree classes in the nursing program, and I got 2 A's. And I ran back after that semester and I said, "Hey, Colonel, I got 2 A's. I can do this master's work." And she said, "Anybody can do that. Those 2 classes." And I'm like, what? You got to be kidding me. She said, "No, anybody can do that." I went back and I got 2 more. I went 2 more classes and got 2 more A's and came back. "Hey, ma'am, I got this. What we're gonna do here? Are you gonna be able to? You're gonna sign off on my application to go?" And she's like, "Well, you know." And I'm like, a light bulb went off. Something is not right here.
Yeah.
Right? Why is this lady not letting me go to this nurse practitioner's program? Right? But like we said, Mississippi, and my mom always tells me, she says, "Son, God takes care of his own." Okay. So the people who I knew back in Fort Jackson, South Carolina, before I got to San Antonio, they liked me. I got on the phone and I called them. They knew the lady who was standing in my way. Right? She gets a phone call from the general. The general was the one who pinned my captain's bars on. I'm sorry, my first lieutenant bars on. And he called and said, "Hey, Ricky says he want to go to the nurse practitioner's program. What's the problem?" Right? So the bottom line is, I ended up getting a master's degree, okay, just to prove to this lady that I can do master's degree work. I walked across the stage with a 4.0.
Wow.
Just to prove to her that I can get master's degree work. So are there obstacles out there? Yeah. But can you overcome those obstacles? Of course you can. Of course you can. Okay. So when people tell me that, "Oh, it's hard," no, it's hard, but you can do it. Okay. No excuses. Like we said in the military, the maximum effective range of an excuse is 0. The maximum effective range of an excuse is 0. Don't let nobody tell you what you can and cannot do. All right. Prove them wrong. Prove them wrong. Not arrogantly, but just prove them wrong. Okay. You said I couldn't do it. Guess what? I've done it. Okay. So now, thanks to this lady, I got 2 master's degrees in nursing, one in perioperative nursing and one in nurse practitioner. So she thought she was holding me back. Guess what she did?
Elevated, raised
She
you.
elevated me.
Yeah.
She elevated me. Sure.
Yeah. So what advice do you have for folks who are going into nursing now? There are so many. There are the lotteries, and the financial part is just so overwhelming. And then also speak to the importance of mentors.
Sure. So for the first part of your question, what do I tell them? I say, go for it. I say there are scholarships that are out there. Okay. There are programs that are out there that are designed especially for people of color to take advantage of. The problem with us is that us being Black folk is that we don't want to go and do the footwork to put the application in. Okay. Yeah. The applications are all asking you the same questions over and over and over again. You just copy and paste your information from one application to another and put in as many scholarships as you can. What's wrong with that? Because those scholarships, a lot of them are going unused. I'm a member of the Capital City Black Nurses Association, and we have a scholarship that we offer. Right? It's like pulling teeth to get people to even put it to apply for it. Wow. I'm a member of the California Association for Nurse Practitioners, and we offer scholarships. It's like pulling teeth to get people to apply for it. Wow. And they're so easy. They're asking you general information. So put it in. Okay. There are things out there that will help you. And as far as mentoring goes, utmost importance for us who are already in the profession in nursing. Okay. We got to get out there and show people who we are. We got to go out there and say, "Hey, I'm a nurse." I take every opportunity to go in with to college. I go down to junior high schools, okay, and tell them, "Hey, I'm standing in front of young people." Okay, that's where it's gonna have to happen. Standing in front of young people, because you know what, that athlete doesn't have to stand in front of them because they see them on TV. Okay. That doctor doesn't have to stand in front of them because he's a doctor. But the nurses, we got to stand in front of folks and start young and say that we're competitive as well. And the the benefits of being a nurse. Okay, great benefits of being a nurse. Okay, the highest respected profession going on for the last several years. Nurses at the very top. At the very top. Now, I was fortunate enough to be a nurse at the very top, and the next one was down was a military officer. I was both, so I'm like, hey, look at me. I'm, yeah, I was what you would call blessed and highly favored.
Yeah.
Blessed and highly favored. And so I'm going to stand up on top and say, listen, you can do it, and this is how you can do it. All right, put those applications for scholarships in. Okay, put them in. Okay, don't let nobody tell you what you can and cannot do. Don't let nobody define you. Okay, do not let anyone define you. You define you. All right. If the mind can achieve it, if the mind can conceive it, you can achieve it. Don't let nobody pour. What is it? There's another saying that my mom says, "Boy, don't let nobody steal your joy."
Yeah.
Don't let nobody steal your joy.
Joy. In August, we have, this August will be our our sixth conference, African American Nurses Conference, Preserve Our Legacy of Nursing. And, we have students who are CNAs, we have high school students who attend, we have college, medical students, just an array of students at various stages in their training and their education. And we always say, you just get in where you fit in.
Fit in, right. Find your niche.
No matter where you are, it's look at the next step and the next step and the next step and get in there. And you'd be surprised at the young folks who are really interested in nursing, but they have the hardest time finding mentors. And we've had several nurses, medical students, and nursing students who have dropped out. Like at the last, they only have a semester to go or whatever, and they've dropped out, and we don't know what happened to them or what were their circumstances. And several we've learned that it's because they didn't have the support, they didn't have the person to get behind them, and they didn't have that that obligation. They didn't feel that obligation to complete or to to actually go through with things. And so I guess what I'm saying is, for people who are in your position who can be mentors, what advice do you have for them who have already made it? You already made it, you've been there and then some.
Right.
And, so what, and if they're not giving back, or they're retired, they say, I'm done.
You're never done. You're never done. You are never done. You always should place yourself in a position that someone can see you. Okay. Someone can see you, and because they're watching you, they are watching you. Okay. They watch, and I know they're watching me. They watch every word that comes out of my mouth. They watch my facial expression. They watch my nonverbals. They're watching you. All right. So I try to place myself in a position that I can be in a position to let my little light shine. Right. I can let my little light shine through Yesty College. I can let my little light shine through the Capital Cities Black Nurses Association. I can let my little light shine that, I'm one of few African American nurse practitioners in the California Association for Nurse Practitioners. Okay. You can let your little light shine everywhere you go. In church. Okay. I'm standing up in church, and we got young folk in church. All right. And we give first aid classes. Okay. It's important that young folk know how to, and I sponsor, 3-4 people to take that first aid class. All right. And they're like, oh, he sponsored me to this class. Yes, I sponsored you, because I don't want you worrying about the finances of it all. Okay. All right. I mean, for some folk, $35, that's a lot of money. Okay. But God has blessed me. He says the more you give, the more He will give to you. Okay, so the more I give, the more He gives back to me. So I don't worry about that. Look, go and take this class. All right, or come on over, and if you want to shadow somebody, I'm sort of hindered as to having folk come over to shadow me unless it's certain special circumstances, like Yesty College that you guys had the opportunity to come over. because we're limited in what the things we do. But there are nurses out there at Kaiser. There are nurses out there at Dignity and Mercy and San Juan and all these other folk, Sutter. Go and be that role model. But we as Black nurses got to be able to say, I want to be that person who I am a shining light that they can see and they can do this. We have to do that. That's up to us, because if we don't, the few of us who are there, when we do retire, we didn't do our job, but we don't have other folk coming into this profession. People that look like us.
Well, Dr. Ricky, we want to thank you so much for agreeing to be one of our presenters today. Our current or our present, one of our present pandemic emergency guest speakers. And, with the programs that we have, and especially in Sacramento, we're trying to bring along or provide that pipeline for healthcare professionals, not only nurses, but allied health professionals and medical doctors, and to let people know that, it is important that we have people who wait on us and who help heal us look like us.
Right.
And it does make a difference, because my grandmother always said the major part of healing is trust.
Right.
And if you don't trust somebody and they're trying to tell you how to get well, you're not going to do what they tell you to do. So you might as well just not even go in and, not even try to heal yourself or get well.
Yeah,
but thank you so much. And if you have any parting words for everybody, any advice?
Yeah, I would say put down the miseducation. Trust the system. Trust the medical system. Don't be afraid to show what right looks like. Don't be afraid to show what right looks like. Be that mentor to bring people of color into the healthcare field, nursing. Okay. Yes, we're in a pandemic, but we still have to take care of ourselves. Yes, we're in a pandemic. We ask for answers to the things that are going on. We can provide those answers. Okay. Trust us. We will help take care of you. Okay. In this pandemic, like I tell all of my patients, even though I've gotten both of the shots, I've gotten them. Okay, but I'm still going to wear my mask when I go out that covers my mouth and my nose. I'm still going to do that practice. I'm still going to practice social distancing. I'm still going to wash my hands. Okay, because that's how that disease is spread. So trust us. Okay, and as far as nursing goes, wonderful, wonderful, wonderful profession that you can do just about anything in. And people, if you do it and you do it right, okay, keeping patients at the center of that, you would be a very successful nurse. And I am so happy that I've had 26 years in this glorious profession, and I look forward to 26 years more of it. And if I can do anything for Yes to College, the only thing you have to do is ask, and I will be there without a shadow of a doubt.
You've been with us from the beginning, and so we're not letting you go.
All right, I'm not going anywhere.
Okay, thank you so much.
Okay,
and
thank you.
We look forward to seeing you at your clinic and at the Betty Irene Moore School of Nursing in your classes. Thank you.
Okay, great. Thank you. Thank you guys for doing a wonderful job.